All righty. Well, I have exactly 5:59 Central Time, 6:59 for you on the East Coast. And I am just going to give a few minutes for people to trickle into the events before I just get going. Here, you should be able to see our title screen and a few Zoom housekeeping things. First of all, it does show that 2 people have their hands raised. If you do not intend to have your hands raised, go ahead and click on participants, and then it'll bring up your name at the top, and you can go ahead and hit the button that says lower your hand. All of the questions for tonight will be answered that are placed in the chat, and those will be answered at the very end of the event. So if you have a question, please just go ahead and pop it in the chat or pop it in the Q&A, and we'll be checking those throughout the event, and we'll answer all of the questions at the end. And you do not have to post in the chat to receive CE credit. So please know that. That's always a question that I get a lot in the chat. Do I have to say hi, or do I have to post that I'm in the chat? Zoom has capability to track your attendance. You will need to be present for 40 minutes out of the 60 minutes of this event to receive CE credit. And that is one of the fun PACE and SERP rules. So we have to follow the rules. All righty. Just gonna wait just a couple more minutes here in case we have any stragglers. And it looks like the chat has been disabled. Someone had commented in the Q&A that the chat is disabled. Let me see if I can fix that. Attendees can chat with, oh, okay. I'm gonna change that. Is that okay with you guys on the Hager end?
Sure.
Okay. And I noticed that you had posted that Q&A. Thank you so much for doing that. Can you go ahead and try to chat again and see if it works? Yay, it works. Awesome. Thanks, guys. What a bunch of team players. Obviously, a whole bunch of dental professionals in here, right? So it is, let's see, 7:01. We have some people from Pittsburgh and New Jersey. A couple people watching while they're still at work. Heck yeah. Hello from Wisconsin. I'm seeing some familiar names that I just ran into at ADHA last week and at RDH Under One Roof the week before. Thanks for coming, guys. Hopefully you all have your samples. If you were at RDH Under One Roof and you did receive your samples, I think it would be helpful to go ahead and have your samples out, and that way you can kind of play with them as I talk about them. If you don't worry at all. There's a QR code at the very end that you can click on the QR code and grab those samples and have them sent to your house. So if you want to take a moment to go get your telephone so you can scan the QR code when I bring it up on one of the last slides, that would be awesome. A couple other questions. Is there a handout? No, there is not a handout for tonight. And I am going to be covering the course objectives. So if you're someone who likes to save the objectives when you attend a CE, go ahead and just take a picture of my objective screen. I don't care. Okie dokie. Well, I am going to go ahead and get started so we don't run out of time tonight. Good evening, everyone. Thank you so much for tuning in. I want to thank Patrick and Dave and Matthew from Hager Worldwide for inviting me to speak tonight and give everyone a little bit more science behind the 3 products that we discussed at our lunch meeting back on May 22nd. And don't worry if you couldn't attend that meeting. I know it was kind of in the middle of the day. Some people can't get away from patients in the middle of the day to watch a CE event. So if you didn't make it to that event, we are going to be covering everything briefly that we covered that day too. But we are going to dig a little bit further into the science tonight. And you guys know me, and you know I'm very much into digging into the science. So I do want to disclose as a speaker that I do teach many international and courses here in the US on dental hygiene techniques and practices for various companies. Tonight, I am sponsored by Hager Worldwide, and none of the images in this presentation were changed in any way. So I do also want to disclose that. We are coming to you live from Iowa. No weather to announce tonight. It's a beautiful evening here, so I don't anticipate any internet delays. Those of you who have heard me speak before know if there's a storm going on, I always warn you. If I start to kind of get all pixelated, I always come back. So here are my learning objectives that I did just explain that I'm going to give to you today. Since there wasn't a handout for this course, if you want to copy the learning objectives down or you want to take a photo of those, by all means, feel comfortable to do that. First of all, we're going to talk about the functionalities and the benefits of using a new product called Fit and Swipe as an innovative piece of dental hygiene armamentarium. And we're going to talk to you specifically why that's a good idea from an ergonomics perspective and from a safety and risk management perspective. Secondly, we're going to talk about the mechanism of action and clinical applications of using the TS1 biofilm removing suction device for cleansing the tongue. We're going to gain some insights on the effectiveness and how we can really enhance patient comfort and patient cleanliness in the whole mouth by cleansing the tongue during a prophy appointment. Next, we're going to talk about integrating the quick detect disclosing solution into patient consultations, into assessment, into your treatment plan, and also utilizing that instant visual feedback that disclosing agent provides, because that's when we really get a really rich opportunity to educate our patients, especially on areas where they might not be doing the best job with their oral hygiene. And lastly, we're going to develop a proficiency in the utilization of different products chairside and enable all of you as participants to optimize your patient care. We want you to achieve the best clinical outcomes that you can get while you're promoting oral health and total health and wellness. And so using these new and innovative products can really spark your curiosity and really motivate you to continue to learn more so you can do better and be a better hygienist. When biofilm is this evident, we don't have to look hard to find it, right? These are the patients that they kind of make my fingers itch, right? They come in and you can see the plaque, you can see the calculus, you can see the stain. That's not always a good thing for them, but it's a good thing for us because then at least we can see what we're doing. But that isn't always happening, thankfully, for the patient. More often than not, and especially when the patients come in for their routine care appointment, because most of those patients worked really hard to brush their teeth right before they came in. So in these cases, biofilm is often invisible to the naked eye. And when this level of effort is put forth by the patient, especially right before they come in for their care appointment, then it's not so easy to see that plaque and that calculus and that stain. So think back to when you were in school. Well, we were taught to remove the deposits from the teeth, whether they were calculus or stain or biofilm. And the goal was, and still is, to clear off as much debris as possible and to leave a surface that will accumulate less biofilm colonization as time passes. So we now understand that biofilm is more significant in causing disease than calculus, right? Yet most of that biofilm is invisible to the naked eye. And it's also unable to feel with your Explorer, whether it's a straight Explorer, Sickle Explorer, 1112 Explorer. You're not always going to be able to feel the biofilm or the plaque retentive factors. And this is one reason why we really focus on what we can do to be able to see what we need to remove, because it's our clinical instinct to remove anything that shouldn't be there. When we use disclosing solutions, the biofilm becomes visible. It turns bright pink or bright blue or purple, and it becomes very hard to miss. I've never met a dental hygienist who would knowingly leave bright pink or bright blue or bright purple stain all over a patient's teeth. And so we may unknowingly leave invisible plaque biofilm behind, but once it's disclosed, that disclosing agent will draw attention to the root cause of the disease, and that root cause is biofilm. Once we can see it, we can remove it. The only way to ensure that the most of the biofilm is gone is making sure that it has physically disappeared. And without disclosing, it becomes a guessing game. We assume it's gone. So teeth aren't flat surfaces. And we all know that cleansing them is a challenge because we have soft tissues in the way. We have restricted access due to where that tooth structure may be in the mouth. Patients might be resistant to us accessing some of those areas. I know we've all had that patient that just doesn't want us to touch the lingual side of their lower anterior teeth. And so the British Society on Periodontology guidelines do require that hygienists in their country record plaque indices for every patient that has a basic perio examination code of 1 and above. As I was reading the research for this course, putting this course together, I found that the British Society of Perio has a little more clear guidelines of when you need to record a plaque indices versus or plaque index versus when you don't necessarily have to do it. They're a little more black and white with their asks of dental hygienists. So basically, code 1 in terms of the British Society of Perio is anyone that has a 0 to 3 millimeter pocketing with at least one area of bleeding on probing. These patients, if they're classified as a code of 1, also have at least one area of bleeding on probing, but no calculus or no root roughness. And so that's pretty much most of our patients, right? And so disclosing makes data collection easier and faster by making plaque visible. And that's why I think you're going to see a lot more disclosing agent being used outside the US because there are a lot more cut and dried guidelines of when those indices need to be taken. And we all know that disclosing agent does make a plaque index a lot easier to do. And so it eliminates the guesswork. It makes us more efficient in preventing over instrumentation. When you can see the plaque, you're not scraping because you can see it and you know when it's removed. So that routine disclosing before oral hygiene instruction, it really engages the patient and it also engages the clinician. So Hager makes a quick detect disclosing agent, and it's a great product. It comes in your traditional bottle form. It also comes in your traditional tablet form. We all remember the tablets from when we were kids. We all probably saw the tablets when we were in hygiene school. Today, I want to introduce you to a newer form of the disclosing agent that can easily assess the presence or absence of old or new plaque through bacterial staining. And you can integrate this in your office immediately. Now, this version comes in a small jar, and it looks like this. And what it says is pre-saturated swabs. And it looks like kind of a small jar, but there's 250 of these swabs in this jar. And so what I like to do, when I worked at the booth at RDH Under One Roof, I know that they had a handy dandy little cotton pliers or a hemostat that they were taking the product out of the container. I think if you just take a sterile probe and you gently reach into here with a sterile probe, you're going to have less of a chance of cross-contamination, and it's one less instrument that you're dirtying, right? I'm a big advocate of the less armamentarium I have to take out and then sterilize, the better, right? So what I recommend is just taking one out as you're setting up your room, take a sterile instrument, go ahead and put it on the instrument, and then just set it right in your tray where it's not going to get disrupted. It's not going to leak all over because this pre-moistened swab is not so juicy that it leaks all over the place. And I love that because you can just set it right on your tray and it's sitting there nice and tidy. And I don't have to worry about knocking over a Dappen dish that's full of disclosing agent and making a hot mess all over my room because I'm not always the most gentle person when I'm setting up my room, especially if I'm in a hurry or I'm running behind. So it prevents spillings of the disclosing agent onto the tray, onto yourself. It also prevents cross-contamination because you're using an instrument that you already took out, you know it's sterile. So it's just a win-win in my opinion. So some more of the science. Shefali and colleagues state that a disclosing solution helps break down so many communication barriers. And there's some very distinct properties that we can look at that show that a disclosing solution is an effective disclosing solution. And these 8 properties include, first of all, it has to be easy to use. We don't want something that's difficult to use, that we have to read a ton of instruction manual, that we have to work hard to interpret it and to integrate it into our daily practice. Secondly, we need to make sure it has a tolerable taste. Nobody wants to have something in their mouth during their preventive appointment that just tastes super nasty. And we do our very, very best, manufacturers do their very, very best to make sure that we are keeping things tolerable at all costs, right? Next, we want to have patient comfort and patient cooperation. If it's a product that's going to burn their tongue, if it's going to sting when you put it in, patients don't like that. And so researchers have indicated in this listing of the most effective disclosing agents that we need to make sure that it isn't going to harm them or it's not going to cause them discomfort. Next, we need to make sure that the dye is able to permeate and penetrate that plaque biofilm and get through that plaque matrix, and that it selectively stains and has contrast to the surrounding environments. What they mean by that is we don't want something that's going to be staining, but then it's staining the plaque a taupe color, right? Or a pearl color, because that's going to be really hard to see against the tooth structure. We also want to make sure that this color is going to withstand rinses to the mouth for a certain amount of time. We don't want to rinse the mouth with water after we use the disclosing agent and have everything that's been stained rinsed out too. We want to make sure it's non-irritating to the patient mucosa and that it's hypoallergenic and that it's water soluble. We also want to make sure it's biocompatible. We don't want to be throwing things in the mouth to stain the plaque that are going to harm the teeth, because that's counterproductive, right? Here's a photo of my own teeth. Now, these are my teeth after I disclosed. Now, I'm a hygienist, right? I think I'm pretty good at brushing my teeth. I brushed that morning, snacked a little bit, and disclosed. Now, you can see on the mesial of 28. This is a crown that does not have a perfect margin. However, I know that I need to use a proxy brush or a water pick when I clean this contact. I'm not as effective as I could be at removing the plaque biofilm in this embrasure space. You know, I call myself a dental hygienist, seriously. But look at the areas where I did remove the biofilm. I'm doing a pretty good job most places. And so what a perfect hygiene education opportunity. Next time I go to the dental hygienist, I want to bring these photos and show her that I actually have been doing my job, right? Except for that darn mesial of 28. So one thing I want to talk about here is you can see this little, what do they call it? A saturated swab. It's kind of like a little tiny ball or sponge of cotton, whatever you want to call it. Actually, I don't even know if it's cotton. It's probably some kind of nitrile. Anyway, whatever it is, it's saturated, but not to the point where it's dripping and it's going to make a mess. Now, when I did this, I started by painting my maxillary teeth, and then I thought, what about if I had a patient that I knew wasn't going to swallow it? I could just have them put it in their mouth like a piece of chewing gum, and they could rinse it around and then spit it in the sink. So when I disclosed this time that I'm showing you this image right here, I painted it on my upper and lower teeth. The next day I disclosed and I swished it around, very similar results. Now, speaking of disclosing, I'm always surprised how blue my tongue gets when I disclose. Now, I brush my tongue, I cleanse my tongue, yet I don't know why it always stains. You know why? Because microbes take residence on the tongue and the teeth and the gums and the oral mucosa. No surface is safe, but the tongue has a lot of surface area we don't think about with all those little papilla on there. And this is a great transition to the next product that I want to talk about tonight that I think hygienists can really integrate into the operatory to make their lives easier and help their patients become healthier. Tongues are gross, right? There's no ifs, ands, or buts about it. they get much more gross when we take the time to disclose them. So as you saw in my previous slide, when I disclosed my teeth, I actually took that when I was in Denver. I disclosed my teeth at the booth for a couple hygienists that were standing there. And then I went out in the hallway and I was like, oh my gosh, I forgot. I had disclosed my tongue too. So I had to go in the bathroom and take a tongue cleaner and clean my tongue off because it was pretty purple. When we discuss this topic, we're going to shift gears and focus on biofilm identification on the tongue as well. So Zucker and Filippi reported in their 2012 study that spanned over a 7-year period that biofilm is significantly contributing to bad breath claims that our patients are making to us chairside. Then again, in 2017, the same group of research reported 11 years of data to show that 62% of patients who visited a halitosis clinic and stuck to a regular tongue cleaning regimen reported that they had bad breath rarely or never. So these same people that specifically sought out a clinic for halitosis, after implementing a tongue cleansing regimen, reported having bad breath rarely or never. So I want you to start just for 1 week. Take an intraoral photo before and after disclosing your patient's teeth. And take an intraoral photo of the tongue before and after disclosing. And I want you to see if doing this aids you in biofilm removal education with your patients. If it does, then keep doing it. Because I really think we need to set a reasonable goal after we go to webinars to really have a take-home point. And so if you're going to take one thing from tonight, maybe start disclosing. Maybe start disclosing and teaching tongue cleaning. Whatever you do, I just like to give tips and tricks as I go through because we've all seen patients with tongues like these. They're white, they're yellow, all those tiny little doorknobby projections that we way back in dental anatomy learned that they were called filiform papilla. They become less visible because they act like a deep piled 70s shag carpet that's collected all of the extra biofilm and all of the extra crud in your grandma's house over time. And that long shag carpeting in your grandma's house, there's a lot of stuff caught in those fibers. And just like that, the papilla on the tongue, there's a lot of stuff caught around there. So what can we do to effectively remove all of that biofilm? And how do we introduce that to our patient during a routine preventive care or perio maintenance appointment? That's what I want to talk about tonight, because we all know that it's not always possible to avoid getting a coated tongue, and we want to explain to our patients how they can treat it. So this is a serious issue, and a lot of patients are afraid to talk to us about this. The study that I just put on the slide there, this study completed by Kieran and colleagues also showed that over 60% of examined patients experienced a coated tongue, with other studies that I reviewed showing 60 to 80% of entire amounts of biofilm in the mouth actually living on the tongue. So this was patients with gingivitis or periodontitis or without gingivitis periodontitis when we consider that, 60%. This helps us to make sense of the overwhelming data that shows that when patients cleanse the biofilm from the tongue, the halitosis complaint subsides. So one philosophy aimed at decreasing the levels of biofilm and the significant patient concern of halitosis is to add a 1-minute tongue prophylaxis and tongue cleansing education session to every single one of your professional oral prophylaxis procedures completed in your chair. Like many other aspects of oral hygiene, this type of cleansing is really best taught chairside, with research indicating that professionally guided tongue cleansing provides many significant benefits to the patients. So during this 1-minute tongue prophylaxis, what we do is we take that deep pile 70 shag carpeting that's coated with dust and grime and last year's Thanksgiving meal and all the stuff that never quite got cleaned out. What we do is we loosen it up and we vacuum it away. When you use the TS1 tongue vacuum cleaner, you have the ability to vacuum it away. And that's the differentiating factor with what I'm going to talk to you guys tonight about from Hager. So this chairside tongue cleaning with added vacuum power, this can be completed by placing the TS1 right on your low speed suction hose. So what I have here is just a low speed adapter, same as your saliva ejector. At the beginning of your appointment, when you're getting your room ready, there you have it, right? This is the product we're talking about. It's got the little soft nubbies on one side, and it's got the louvers openings on the other. So what you want to do is go ahead and place it before you see your patient. Then when it comes time to do the patient education, I like to recommend after you've disclosed, so you can show them all of that purpley blue stuff on their tongue. What you want to do is hold on to the tip of the tongue. If their tongue is kind of slimy, go ahead and grab a piece of dried gauze. You can hold on to that tongue and put a dab of this tongue cleaning gel. Now this comes from the company as well. You can use toothpaste, you can use tooth gel. It doesn't have to be this proprietary cleaner. What this does is it acts like a lubricant or a surfactant, and it makes the tongue a little more slippery. So you can get this nubby side on there and rub on there. Then you flip it over and you guide the debris to the vacuum pressure to suction it away on the louvered side. You can see how there's some openings there on that side. So after you rub the gel all over to loosen stuff up, then you cleanse it away. And I know what you're thinking. You're thinking, Emily, 1 minute is so hard to find if I talk about doing this for every single patient. But I think the benefits you're going to be able to give to your patient far outweighs that 1 minute. And just finding that 1 minute so you can help your patients out and you can integrate this into your prophy appointment, I think it would be very beneficial. The other cool thing about this is you can rinse it out with some water after you do your education. You can pop it off the line, bend it straight, and you can give it to the patient. And you can say, here, this is your very own tongue cleaner, so you can do this at home. Now, the cool thing about this is it is very, very small. It's probably about 1/3 to 1/2 the size of any other tongue cleaner that I've seen on the market. I did some measuring on it. I know we weren't going to have a whole lot of time tonight to get into all the measurements, but what I can say, it is very small. So patients who usually gag when you touch their tongue, they're going to have a less incidence of gagging when you use this. The other reason they're going to have a less incidence of gagging is because as you're bringing that biofilm and that junk off their tongue, it's being suctioned away. So it's not gumming up on their tongue and they're not going, what do I do? Where do I spit this? Right? It's suctioning it away. So to complete this process, you really only need to add one additional thing that you're not already using, and that's going to be that TS1 device. And these come in packs of 100. They're very affordable, and the patient's already been disclosed, and you already have your saliva ejector in your operatory, so you're not going to have to buy new stuff. Now, yes, you can buy this proprietary gel if you want, or you can use the toothpaste. Go ahead and open up the little sample that you're going to send them home with and use that on their tongue. Because regardless of whether or not you use this, it's called tongue clean gel paste, or you use just whatever regular gel product you're recommending or paste product you're recommending. Maybe they're a patient that they like to, you like to recommend a sensitivity product. It's not really going to matter. It's regardless of what the components of are that are whatever's in the toothpaste, it's not going to matter. If it has potassium nitrate added, if it's sodium fluoride, if it's whatever you're recommending. So the TS1 tongue cleaning gel is there if you want it. And I do have a video I'm going to show at the end if we have time that I can show you this whole process of what it looks like. But what you can see on the screen here is an advertisement advertising the TS1. This shows that little nubby side close up. And then this shows you on a mannequin tongue what before and after, how much of that gel I actually applied when I did the demo. So for the continuation of the tongue cleaning at home, you just give the patient their suction device after you rinse it out with a little bit of water. And this process helps the provider encourage tongue cleaning at home, as well as making this TS1 a sustainable product. Now, for those of you who know me, you know I'm not what a lot of people would consider like a tree hugger. But I have been doing a lot more consideration in the level of waste we're putting into the environment. And this makes it one less thing that we're throwing away in the operatory. Whereas the patient can take this home and continue that process of clean and fresh feeling and having that good, positive feeling when they get home. The product also has a very low incidence of gag reflex. So this product is very, very small. And I do want to encourage you to try it out. For those of you who already have samples, try it on yourself. And for those of you who haven't had a chance to get samples yet, I'll put that QR code up at the end. So I know a lot of you are telling me, I already tell my patients to brush their tongue. And this is great because Matsui and colleagues, they stated that tongue cleaning has a much longer effect of decreasing the biofilm on the tongue than if they're using toothbrushing alone or if they're brushing their tongue alone. So tongue cleaning and toothbrushing should both be performed to reduce the bacterial load. Yes, they're both effective, but what's more effective? Well, the research indicates tongue cleaning rather than tongue brushing. And the research also indicates that when tongue cleaning is added, the oral microbiome load as a whole is significantly decreased. There's many types of tongue cleaning, yet the University of Basel did a study that indicates that the use of the TS1 tongue cleaner with the vacuum engaged, meaning you have it on your slow speed suction and you have your suction turned on. When you use it correctly, this device is almost twice as effective as tongue cleansing alone. This is why I believe that when we show the patient, we get the patient 2 hours a year. What do they do about the other 363 days, 364 days on a leap year, right? So this is something that we can give them and they can integrate at home. The next thing I want to talk about is the concept of removing biofilm from the mouth, along with all of the other plaque retentive factors that cause it to stick where it's sticking. So everything that's keeping that biofilm stuck in its place, whether that be, the plaque formation pellicle process itself, a giant chunk of calculus, a bunch of stain, leftover cottage cheese or leftover steak or leftover salad or whatever that biofilm is living on. From the patient's perspective, this is what the hygienists are best at doing, right? We're the best at getting that stuff in there and scraping it off and getting it out. So changing the perception of that whole concept, that's for another night, right? But tonight I want to discuss what you do with that schmutz, that junk that's left on your instrument once you get it off the tooth or once you get it out of the mouth. What are you doing with it? Another thing I want to talk about is the ergonomics aspect of what we're doing with it. And ergonomics is a hot topic in our industry and absolutely deservingly so. We know that we are being injured by repetitive motion, static positions, and excessive twisting and bending. Gupta and colleagues remind us that one way that we can decrease the wear and tear on our bodies is to avoid awkward reaching postures, as these reaching and twisting postures provide even more stress on our spinal discs when we're lifting and lowering and handling objects as our back is bent versus when we're sitting in a neutral position, right? So these repeated tasks, whether we're kind of sitting wonky or even when we're sitting straight, if we're twisting and turning and reaching, we're putting ourselves at an increased risk. So what can we do about it? What can we do when we leave the mouth to wipe the debris off the instrument? So whether it's a sterile or non-sterile gauze we're using, and whether it's on the tray, it's clipped to the patient's napkin, whether it's wrapped on our finger, regardless of where we're turning to wipe off the instrument, we're probably doing some unnecessary twisting and bending and reaching. So what can we do about it? This is the last thing I want to talk about tonight. And this is a device that Hagar has launched to keep us compliant with having dental instruments that are as clean as possible and having a mirror that is as free of debris as possible and clean and reflective, and we're able to see out of it. So it's so important where we're wiping our instrument to remove the biofilm, because we don't want to carry that biofilm from surface to surface to surface to spread it around. So we do want to wipe our instruments, but we also want to wipe them in a way where we're maintaining the sterile nature of our instruments, we're maintaining our compliant procedures as we work, and we are avoiding hurting ourselves from an ergonomic perspective. So one solution to avoid this excessive movement from the mouth, while we're still maintaining the ability to cleanse and we're keeping the instrument working end as free from debris as possible, is the use of the fit and swipe and the fit and swipe dry. Now I'm just kind of taking my rings off because I forgot to take them off before I started the webinar. I'm going to place some gloves on my hands here, and I'm going to flip slides so I can show you these gadgets that I'm talking about. So the Fit and Swipe Clean and the Fit and Swipe Dry from Hagar are the unique products with pre-applied adhesive backing. They safely adhere to wherever you stick them in many different placement areas. Now I'm going to show you, I'm right hand dominant as a clinician. So if I have, my probe in my hand, it's going to be my right hand. Notice that the sponge is still on there. It doesn't move. Once you get it on the tip of that sterile probe, it isn't going anywhere. So if I have my probe, it's in my right hand. So what I want to do is I want to put my instrument cleaning Fit and Swipe. This is called the Fit and Swipe Clean. I like to put it right by my thumb, right there on my glove. See it? So I keep the white clean tab on my left hand so I can easily wipe while I'm still in the mouth. Now, the blue tab is the Fit and Swipe Dry. And what really amazed me the first time I separated these, the first time I had one of these in my hands, is how easy it is to peel these little backings off. At first I thought, boy, I'm gonna have to fold those over before I put my gloves on, or I'm not gonna be able to get the sticky paper off, but it's pretty doggone easy. So I like to put this blue one on the inside of my palm, right there. And you can play around with it, find what works best for you, because I find when I use my mirror, it's just really easy for me to wipe it like that. Since I'm right-handed, obviously my mirror is in my left hand. So I can maintain a dry surface for both sides of my mirror. I really like to use a two-sided mirror so you can wipe the back, wipe the front. And what these Fit and Swipe products provide for benefit include, a high cleaning effectiveness with absorbent materials. So I really like how when I take my probe, well, let's take the side without the swab on it, and I wipe it on here. At first I thought I was going to poke through there, right? If I had a sharp curette or if I had a sharp scaler, I was going to catch that and poke through there. But it's really, I can poke into that pretty hard with some pressure, and I'm not going to permeate that bottom part that's stuck to my glove. It's really pretty durable. And so it's very absorbent. So if you have some blood or some biofilm or some other stuff that comes off with that calculus, it's not going to, fly away. It's going to stick to that area. It's a pretty practical situation, and it's also really good because it keeps you in the working area. You're doing much less twisting, bending, reaching to try to find your gauze. The other thing that I really liked about this that I didn't read in the literature, I don't know if you guys are like me, but I used to drop at least one gauze per appointment, if not two. And it was always the grossest one that landed on the floor because patients would get up and they would be like, because once it's on the floor, you can't get it until you go to like take your gloves off. And then if you forget it's down there, you don't, and they kind of look at it like, what the heck? But that's one thing I did notice. These things, once you get them stuck to your glove, you can't really pull them off. They're made that way so they don't fall on the floor. And so I really like that about them. These products do a really incredible job. Now, I did have someone ask me, and so I did ask the company, can they be autoclaved? And I know when I talked on May 22nd, a couple of you are like, why would you want to autoclave them? So they can be autoclaved before use because certain practices who do a lot of perio surgeries, who work in a school setting, some people prefer to autoclave their gauze or autoclave whatever they're wiping their instruments on before they use it. So it's perfectly fine if you want to take one of those tiny sterilizing packets and put one blue one and one white one in. You can pre-sterilize them in small stereo packets before use. For those of you who use non-sterile gauze on the regular basis, it's perfectly fine to use these right from the manufacturer's packaging. There's no problems with that at all. I just wanted to let the people know who are sterilizing their gauze that the adhesive on these products can withstand that sterilization process. So it can be safely placed in a variety of glove locations. So some of those locations include the palm, the side of the hand. Some people like to put them right here on the side of the hand, on top of the glove. They can even be stuck to an instrument themselves or inside of a rubber dam setup. So a lot of endodontists really like these microfiber white pads to wipe their endodontic files on, and they can be placed and stuck right to the inside of that rubber dam. For those of you who are doing sealants and using a rubber dam for your sealants, you could pop one of these right on the edge of that rubber dam for your sealants, or even an Optrogate. I had an Optrogate out, and I stuck one to around the edge of an Optrogate. So lots of places that you can safely stick these, and then you can just throw them away. So to review, the white microfiber of the Fit and Swipe Clean is incredibly soft, yet incredibly durable. It withstands the sharpness of surgical instruments, curettes, scalers. It shows here a scissors. It shows the endodontic files or the brooches. And you can also use it almost like a pin cushion. The pile on that white microfiber is pretty thick. The blue fabric of the Fit and Swipe Dry is very effective at removing that greasy, oily contaminants. You know how sometimes your Profi paste can make your mirror feel greasy or oily? You just wipe it off on that blue microfiber and it brings you back to a mirror that doesn't have streaks. It decreases the fog and it generally improves your vision. So it's a win-win. Now, if you are someone in the audience who has not received your samples, or if you want to grab some samples, please take a moment to get out your phones, and I will slow down a bit so you can get out your phones and take a picture of this slide or scan the QR code, and Hager Worldwide will be happy to send you a sample of each of the 3 things we spoke about tonight. So the disclosing swabs, the TS1 tongue cleanser that fits on your slow speed suction, and then the Fit and Swipe Clean and the Fit and Swipe Dry. Now, the other thing I did want to mention is these come in packs of 50. The packaging is really clever. It's just a long, skinny Ziploc type bag, and all of them have the sticky right on them. So you can keep them chairside, store them well. And these are my references from tonight. You guys can go ahead and grab a photo of this slide too if you want. Check my research. Make sure that I'm not just telling you things to tell you things. And then I also want to put up a couple pieces of information. Dr. Dave Price's, pardon me, Mr. Dave Price's email address and phone number, and then my email address and phone number as well, in case you have any questions that come to you later on when you're getting ready for bed and you have a burning question about one of these products. You can always email me or call me tomorrow, or you can call Dave. So the next thing I want to do is open up the questions. And I also want to briefly show you the video since we have a moment here. Here is the video. I tried to embed it into my presentation and for some reason it wouldn't play. So I'm going to go ahead and share my screen with you and play it right now. All right. Can you see that video, Dave? I'm going to play it right now. So you can see I have that toothpaste on there. I'm rubbing it in. I'm flipping it over and I'm suctioning it off. And the reason I use the regular standard toothpaste that we give to patients at the college is I wanted to show you you didn't need to have the fancy paste. If you are working in an office that tells you absolutely not, we will not buy you this fancy paste, you can use what you already have. And so I'll play that video one more time. Use the nubby side to rub it in. Flip it over. And the reason I wanted to show you this twice was this whole video is 22 seconds. So 22 seconds of actually cleaning the debris off. And now I can open it up for questions. Oh, Dave, I can't hear you. You might want to test your sound. I'll go ahead while we're waiting. And
Can you hear me now?
I can hear you now. Thank you.
Very good. You're welcome. Someone asked to have my picture, Dr. Price's picture up again. So,
Oh, sure.
yeah, I'm not actually a doctor, but I think
Hey, I just gave you a doctorate tonight. You're welcome.
I'm glad. That's nice to know.
Mine took me a long time, so I just gave you yours.
Yeah.
I'll
I didn't
pick
mean
that
that like
back up.
with you. I mean, that right. It didn't come out right.
That's okay. I think it's hilarious. Oh, shoot. The folks on this call that know me know that it's pretty hard to offend me. All righty, here, share screen. There you are. Share. And there's that information. I'll also toggle to that other screen that has the link for the samples too. So if you want to grab a picture of the contact information and there's the QR code. So I'm just going to scroll through these questions. Is there a gift card tonight for participants? No. There was a gift card a drawing for a chance winning of a gift card for the Lunch and Learn, but there's not one for tonight. I teach in dental hygiene school. Would you think it would be a good idea to have students use the Fit and Swipe product? How often do you accidentally prick yourself by missing the pad? Actually, I have used these a few times and I have not accidentally pricked myself. It's really amazing. And you can kind of play around when you get your samples, but you have to put quite a bit of pressure to permeate the white pad with an instrument. And you can kind of do some testing on your own part, but this thing is pretty thick. And I think that, if you're asking me personally, Emily Bogey's opinion, not research based, I would think that you would have a much greater chance of poking yourself or a patient using a 2x2 than with one of these guys, because it's pretty doggone thick. If placing on an instrument does the adhesive, Deb, if you want to type your question again, it only saved half your question. I bet it's gonna ask, does the adhesive remain on the instrument? No.
That's,
The
yeah,
adhesive,
that's what it is.
can you speak to that, Dave? I'd like to hear
Yeah,
your.
no, yes, I can't speak to that. It does not stick to the and no residue on any instruments that we've seen, and nobody's said anything about it.
Thank you. There's a question here. Can you purchase just the clean or just the dry, or do you have to get both? You can purchase them in separate packages. And
Mhm.
that's what I think is so cool. Honestly, I would be much more inclined to use more of the white ones and not so many of the blue ones, because you can wipe your mirror several times. But we've all been in this situation where you have a patient with a whole lot of schmutz in their mouth and you go through a few gauze. And so you could put, 2 or 3 or 4 of these on one glove, or change your glove, change the pad, whatever you want to do. But you can buy the white ones separate from the blue ones.
Mhm.
Next question. If placing in an instrument handle, does the residue remain? And no, thank you, Deb, for reposting that. It does not remain. It peeled off every instrument I've put it on anyway. And I did try it on a metal handle and a resin handle, and I didn't have any adhesive left behind. If they can be autoclaved, is there a special setting for them? Temperature, pressure, time? When I autoclave them to test them, I just put them in a regular package cycle, because I put them in individual little packages, one blue, one white, and just ran a couple test cycles. And I just did it on the regular programmed packaged autoclave setting. Same thing that we put packages in the autoclave with 2x2s or loose instruments or wrapped cassettes of instruments. I missed the scan. I went ahead and put that back up. So I'll leave that back up for a while too for you. Can samples be sent to my home address, or does it have to be the office address? That's for you, Dave.
We can send them where you want. That's not a problem.
Because somebody at the office is going to pilfer them because they're really cool. That's what happened to me too. I totally understand
Yeah, not a problem.
that. Dave's like, why does that matter? No, it does.
No, I
Especially
believe
if you're in a big office.
yeah, I can imagine.
Are the pads safe to put composite material on and then place in the mouth? I don't know if they are safe for that. I will let Dave
No,
address that.
no,
However, no, they're not. Okay, so you can't put the composite on the pad and then put the composite in the mouth. I
no.
did test them with wiping composite off a dirty instrument, and they did work though.
Yeah.
All right, so we'll mark that guy answered. How can we order them? That
Yeah.
is, go ahead and take the information from customer service at hagerworldwide.com, or you can contact Dave.
Yeah, and I can answer that real quick for everyone. We sell through distributors of all types. So if it's Atlanta Dental, Benco, Darby, Shine, Dental City, it's really hard to find a distributor that we do not work with. I mean, they're almost non-existent. So my answer to that is whomever you get your supplies from, your consumables, we'll have them. I feel safe in saying that. So
These
yeah.
are really, really good questions. And I wanted to leave some time at the end because I know last time when I did the lunch and learn, we didn't have very much time for questions. The next question is, doesn't this run the risk of sticking yourself if you're rushing or if you move your hand too fast? The one thing I will say is you could also stick it to the side of your suction. You could stick it to your mirror handle. It doesn't have to be stuck on your glove. But that all goes back to risk management too, and knowing where the working end of your instrument is. And so food for thought there. For the disclosing sponges, do you keep it on the probe to apply to the teeth or pinch it with your fingers to apply? When I applied it to my own teeth, I kept it on the probe the first time I did it. The second time I did it, I just took it off the probe, put it on my tongue, and swished it around my mouth like it was a piece of chewing gum. And then I spit it in a Dixie cup. And that's not necessarily the manufacturer's recommendations. However, if you have an adult and they're perfectly able to spit something out, I think that would be the easy way to do it. So you can apply it with a cotton pliers, you can apply it on an instrument, or you can apply it with a hemostat, however you want to apply it. But what I really, really like about it is it's not drippy and you don't have to worry about having that dappen dish of product that you're going to spill on yourself or on your patient or on your floor or on your counter. What's the next question? I work in pediatric dentistry. What age can the disclosing solution be used? I have never seen an age limit on disclosing agent because it is hypoallergenic and it is a stain and they're not ingesting it. They're spitting it out or we're rinsing it off. I have not seen an age recommendation on that. Dave, can you speak to that? I don't know the 100% answer on that.
I'm sorry. Can you where are we?
I
Which
absolutely can repeat the question. Yes. So someone works in pediatric dentistry. Is there a minimum age where disclosing agent can be used?
not that I'm aware of, it's non-toxic. Just real quick on another note, somebody asked about red dye allergies. This doesn't have red dye 40. That's the real culprit. And there are instructions for use and MSDS sheets. So for pediatrics, I mean, there's nothing, it's non-toxic in every way. I think it's going to be a practitioner's call based on the patient, the circumstances, and all. As you said, Emily, we all have these as kids. Now, what kids are varies, so I can't give a pat answer. If it's ingested, it's fine. It is completely non-toxic. So if you're comfortable with a little swish, hey, just put a lip or chew the tablet, spit it out. That's fine. It won't cause any problems.
Another person asked to see the QR code again. I left it on the screen. Is there a CE Zoom code for this evening? I didn't see a code that you would have to enter to get your CE credit. I will let Matthew have a little time on that one. Matthew, if you could put it in the chat if there is a CE code for CE Zoom. The next question is there anything that easily takes disclosing solution off countertops? The only thing I've ever found is a disinfectant wipe, and I've left it set on the counter for a while, and it pulled some of it off, but I know we have stains on our brand new counters at school from it, so it is a bugger to get it off if you get it on a countertop. Is there a certificate we will get to prove that we attended the webinar? That's going to come to you through CE Zoom. Usually CE Zoom has you fill out a survey before you can get your credit. Comment, yes, the pad is thick, but it is quite small. My answer to that would be if you're worried about the pad being too narrow, put a couple of them on your glove or a couple of them on your instrument. I guess that's a great thing to tell the manufacturers, since they're right here with us tonight, that we want a bigger one. We want a bigger option. Love it when we can tell the manufacturer directly. So maybe a bigger one, second generation. I don't know. Any other way we can get a sample, since I'm watching on my phone, so I couldn't capture the code. I think if you would, and correct me if I'm wrong, Dave, if they email customer service at hagerworldwide.com, can we get them a sample that way? Because
Yes,
I do know a lot of people do watch these events on their telephone.
yeah, that's not a problem.
Thank you for being accommodating. So Callie, your question, go ahead and take a picture of customer service at hagerworldwide.com. And we almost have all the questions answered. Will there be an on-demand version of this course so I can refer my friends? I am not sure about that. That would be a great question for Dave.
Let me talk to Matthew and Patrick. That's certainly we could take under advisement. So yeah.
Or I can give it again and whatever
Yeah.
works. Or you can visit Hager at the booth. They're really good at showing at the booth what the products are and how to use them. Is there a code to verify we took the course? I already answered that. There's a statement in here about the removal of biofilm, and new research says it may prevent Alzheimer's. Always good to see oral systemic link comments. I'm old school. I wipe on the bib. I like the fact that patients can see how good or bad they've been. Could possibly need to cover my entire arm with these white pads. Yeah, I mean, but the other thing is you could put them on the bib if that's something that you're used to and you have maintained safety with that. There's nothing that says you couldn't stick it on a patient napkin, I suppose. Does autoclaving affect the adhesive or the stickiness? Not in my experience. I autoclaved 4 pairs of them and they all were fine to use. In 4 different loads I put them. Is there a quiz and code for tonight? That would be through CE Zoom. How much does the tongue cleaner gag patients? And in respect of your time, it is 6:59. I'm going to let Dave answer this question
Yeah.
while I go through some other questions.
Yeah, that's a good question. And but what we have found is that the suction part, two things. One, it's very, very small. It's really smaller than it appears. So that helps a lot with the nubby side. But then when we flip it over, the suction works against the gag reflex. Because I had somebody ask me that before when we were first bringing this out, a dental hygienist I know. And we found that this suction from the evacuation system, for whatever reason, really inhibits the normal gag reflex. And that's why it's so popular, or it's popular in Europe here, and we've not had any complaints about gagging. Of course, you can go overboard, but that does help.
Please know that, you aren't tied to staying here if there's somewhere you have to be at the hour, but I'm just going to keep answering these questions because I know it's important to people to get their questions answered. Will we get a confirmation email after submitting our information and address for the products? Does Hager reach out, Dave, or do they just send the product?
We normally don't send them, but I can talk to Shannon. I mean, if that's who I work with, my partner in crime at the office, and I can I can tell her if these come in to let me know, and I'll verify the
Hey guys, real quick. I put the link to the sample in the webinar chat, so you don't have to use the QR code. There's a link in there. And then also the code is 3PHCLW. And you're thinking, what on earth could that be? But if you went 3 products a hygienist can't live without, first letter of all that. So 3PHCLW is the code. It's in the chat.
3PHCLW. Got it.
You got it.
Right. So this is an important question here from Mary. Can this disclosing agent be used if a person has an iodine allergy? Yes, because I did check the ingredients for iodine when I received the samples, because I have a friend with an iodine allergy. The ingredients are water, sodium benzoate, sodium sorbate, sodium chloride, sodium sulfate, lactic acid, and then that is all. So that you do not have to worry with an iodine allergy. Can the patient purchase this agent online, Dave? I don't know the answer to that question.
Well, I shouldn't say no, because you can get anything online now with eBay and Etsy and Amazon. I'm not, to be honest with you, Amazon has a dental store. We don't play there, so I don't know if they have it. I suspect not. So the answer would be no at this point, as to my knowledge.
Also, I've had a couple recommendations here. Alcohol takes disclosing agent off some surfaces, someone commented, and hand sanitizer works as well. That one's asking for the code. We already did that. CE Zoom is asking for. Oh, there's a question here. Will you be at the Dimensions of Dental Hygiene Convention in Anaheim, Dave?
The answer is yes, we will be.
All righty. Let's see. I think all of these other ones are about the code. And the code is, again, where did that chat go?
It's right here. I can read it off. It's 3.
Thank you.
3, P as in Papa, H as in Hotel, C as in Charlie, L as in Lima, W as in Whiskey. 3,
Perfect.
3PHCLW.
What about celiac disease for the disclosing agent? Also not a sensitivity. There's no gluten, there's no there's no danger for this disclosing agent with that condition. And will you be at Greater New York or the Pacific Dental Conference in Vancouver?
No.
Okay. All right, guys. Well, it is after 7, and I do want to be respectful of your time tonight. Again, I want to thank Hagar for having me tonight, and I want to thank you all for listening. You guys have been great attendees with great questions, and I do wish you the best. Have an awesome night.